And the hardest battle I've ever had to face was my mental health. I remember being told by both my parents as I got older that younger me was never able to be, the normal child. And at around 6 years old, my dad was admitted to the hospital and had immediate open heart surgery to clear multiple clots. When I was 10 years old, my father passed away, alone in a hospital bed. He was in a coma for 3 months prior to that. And so I never saw my dad again. And it started this downward spiral. I had a lot of anxiety about everything and everyone. I didn't want people to leave. I didn't want anybody to leave. So I was scared that people were either gonna die or just walk out. Because after that, I lost his side of the family too alongside with that, and it kind of just left. That's how I felt, that's what I thought. So I was scared of people just leaving or dying. At around 13, 14 years old, my sister had gotten kicked out. And what's important about that is my sister was the one that was taking care of me while my mom worked. And I was broken. I was tired, I was broken, I was exhausted. And then I was trying to help with my younger siblings as well. So everything kind of just piled up. I was just exhausted. It's feeling like your chest is falling in on itself and someone's just squishing your lungs. And I would feel an overwhelming just dread. I would always feel it. It was a drop in my stomach. I was never comfortable where I was. I'm waiting for something bad to happen. Every day, every moment, I'm just waiting for something bad to happen. Nobody understood what was happening. Nobody knew how to help. Nobody knew what to do. I was too young to actually really do anything. I was just confused. Everybody was confused and frustrated. So we kept trying, going through circles, seeing doctors, trying, and they'd put me on medication. It turned me into a zombie. I had a personality, and then I just didn't. I wouldn't really talk to anybody anymore. And then it made it harder to tell people what was happening. Then at one point it turned into the self-harm. It was pretty difficult at the time. I just felt hopeless. I felt frustrated. I went in to see my primary care physician, Dr. Anzalone, who called in Dr. Tam, who shadowed my appointment. And that's when everything got moving.
The NCF Mental Health Initiative ensures that children and teens are connected with behavioral health resources, specifically crisis care, individual therapy, and family assistance. The behavioral health services at Healthcare Network are very unique because we have an integrated care model, which means that we have behavioral health clinicians embedded into medical clinics. And the nice thing about this is, as children or teenagers come in to meet with their primary care medical providers, if behavioral health concerns are identified, the medical providers can ask behavioral health clinicians to come and meet with the patient that day, and that's known as a warm handoff.
It was the first time somebody understood and took the time to understand me. And that was the starting point of actually getting the help I needed. Last week, I was dealing with a really difficult student, but it reminded me a lot of myself. Somebody was actually there trying to help me, but not just push me, but move forward with me. Right medication, the right help, all of that took me to where I am now.
While working with Micaela, it's been very rewarding to see the changes that she's made.
Everything is better. I have a relationship. I have a better relationship with my mother and my sisters due to getting help.
It's great that you can manage stress because working in a room full of 4 to 6 year olds, I'm sure gets pretty stressful.
I currently work as an assistant teacher for a pre-K classroom, and I do plan on going to college. I want to be an ER nurse.
Without funding from NCF, our integrated care model would not be possible, and this model allows us to ensure that we're addressing the needs of all children in a timely manner.
The difference between before and now is just so insane. It's wild. There was genuinely a time in my life where I thought I was gonna die, and I thought it was gonna be, unfortunately, due to my own self. Now, I have all these things going for me. So no, I'm not just alive and okay. I'm doing amazing. I'm doing great. Without NCF's mental health initiative, I would have never gotten the treatment that I received, and I would not have been here today.